last section is section 7. So now we have the baby. We have to do some assessing to just make sure that the newborn has a good level of health. The first step going to be Apgar exam. So Apgar comes from different criteria, which we're going to talk about this. But for now, we have to do the Apgar right after birth and also 5 minutes later. So it's just assessing heart rate, skin color, respiration, muscle tone, response, different response to painful stimulus like pinching, that kind of stuff. Any score like 7 or more than 7 could be a good sign of having a healthy baby. So what is Apgar scoring system? Like you can see, the criteria just coming from here. A means activity or muscle tone. P means pulse, G means grimace, and so on. But here, just look at this part. It is just points. We can see like different points. For example, if muscle tone activity would be absent or it would be like less, we would go for 0 and 1. However, if it would be active, we would go for 2. This goes for the pulse as well. For example, if it would be absent, it's going to be 0. But if it would be like below a certain number, here we can just see 100 BPM. It can be 1 point. So this whole criteria must have a score for like 7 or even more than 7 to show us we have a healthy baby. I really like my personal preference is the appearance part or this part. It's just the color of the skin. I feel like it's just so cute because the pink color is a good sign, is a good sign of having a healthy baby. Pink body might not be a good one. It means like a 1, and like blue or pale, it's a bad sign. So there might be some complications right after birth or during the birth. For example, umbilical cord might wrap around the baby's neck, and it is not good, obviously. There might be some fetal distress, high or low heart rate. Baby's position might be bad, like sometimes I guess you heard that they say, for example, the baby breached or like there is a situation with the baby. It is the same case as a umbilical cord most of the time. So baby's position is important. The best position for the baby gonna be when the head is just close to the cervix. So it just come out right in a good way and so easy. There might be some condition for mom as well. For example, uterine rupture is just bad for mom, especially it comes from moms who had prior C-section. A solution for just not having that kind of problem can be a C-section. So I mean, C-section is not bad, but it's not good. It is not good because it's a surgery, and all the time we just try to go for the natural situation and avoid any sort of surgery. But when we have like some sort of uterine rupture or like baby, a bad position for the baby, or if we have like umbilical cord wrapped around the neck, so obviously we have to do the C-section. There is no other way. Nowadays, the number of having C-section is just increasing a lot. For example, it was just 5% in 1969. Now it is just more than, I guess, 35%. This statistics is related to 2004. But nowadays it's just even more because of different environmental situation that can impact mom's health, like maternity health. So C-section nowadays is just more common. There are 2 other terms and hazards for the baby. So we have preterm babies. They might have anoxia or problems breathing. They might be less mature. Like they might have like less mature brain patterns, or they would be less mature cognitively. They might be difficult to soothe, they might be more disorganized, they might be at risk for different physical and behavioral curves. There is another term, gestational age or SGA. It is kind of different from preterm, and it might have more serious problem. Um, Children who are like SGA, they might require some specific needs like NICU, like some special care that they have to just be monitored all the time. They have to just stay at the hospital. They might have like poor muscle tone, and they might have like poorer recognition memory as well. So what is NICU? NICU is just a section in a hospital that separate babies from parents and put them in very hardcore specific medical condition. Uh, it is good for the health of baby because like it is a medical condition and we want to just help baby to survive. However, it might have some negative impact as well. For example, it might hinder parents um, to interact with their baby. So there might be some problems with baby's stimulation and perceptual sensation and that sort of development. Because like basically the baby would be in NICU for a period of time. No one would interact with them like a typical baby. Like, for example, if we would have a typical baby, they would have mom around. Mom can just feed them. Mom can just touch them. But like a baby in NICU doesn't have that kind of privilege. So they would be isolated from any sort of attachment to mom. So it might have some sort of detrimental effect on them. So there are some solutions for that. For example, hospital would just schedule sometimes for parents, especially mom, to spend time with their children, touch their children, try to just breastfeed them if it is possible. And like at least touch them and just talk to them and just be around because babies are sensitive to even mom's voice from the beginning. So it would be nice and just helpful to have just mom around. So here's all about chapter 4. I want you, like always, to just read the whole chapter and also the book section and just get ready for your quiz. See you in the next chapter.